All right, everybody, good morning. And we're cruising around a little local shopping mall here, kind of more of a strip mall, but it's indoors. Interesting phenomenon here. The Hong Kong rents are really, really high for shop spaces, and a lot of them went out of business because it's not enough business to support it. What they're doing is they're replacing some of the landlords and stuff. Instead of renting it out to somebody, they're putting in these like game things, like different types of games to sort of offset that. Apparently, if you put these in, you can actually almost cover your rent, so to speak. So anyway, it's a rather interesting situation. Today, what we're doing is taking my great nephew to the doctor, and I'm going to show you what a doctor's office looks like in the U.S. or in Hong Kong. What would you get him, a car?
Yeah.
What do you got? What do you got, Willie? This is Willie Wong.
Let me see.
It's William Wong. There he goes. Yep. Is that battery?
I have a battery already. She said.
Okay. All right. So anyway, so what we're doing is going to the doctor up here. Now, as you can see, these shops are very freaking small here. There's a travel shop right there. I mean, these spaces are like 8 by 8, maybe 8 by 10 at max. Some of them are bigger. But here we are at this place. Here we go, Willie. This is great. Look at this place. Wong's Pain Management Center. Okay, well, here is a doctor's office. This is Dr. Su Wan Yap. So he's a local doctor. You have a certain medicine. Anyway, look at this place. Basically, he have just a little bitty office back here, back there, and then this front storefront, and this place is packed with people. So you really don't make an appointment here per se. You just walk in, and when they get to you, they get to you. Lily, how much is a doctor's appointment here for just walk in to go to the doctor?
You can just walk in, or you call before you go.
Yeah. How much is the appointment cost? How much?
No appointment.
No, honey. How much to see the doctor?
I don't know.
Okay.
I don't know. I don't have.
So normally they charge you for the doctor visit a few hundred Hong Kong.
I think they said about 500 something, 600.
Okay, so that's like $60 US.
No, 我都想喎，醫生書，我仔未結婚。
So going to the doctor, see him about $50 or $60, and like Kwan La, Josan, sister, Lily's older sister, and then you get the medicine and everything here. It costs you like $500 or $600. So anyway, far more efficient delivery system than what we have in the U.S. Affordability-wise, access-wise, you name it. We need to really look at a tiered system in the United States to get our hands around it, and maybe get rid of some insurance companies too at the basic level. You get rid of if you get rid of the insurance companies, you get rid of a lot of the bureaucracy. Like, for example, this place here has one lady working inside, and you can't really see it here. It has one lady working back there, and that's it. Hey, Lily, you can sit down in there.
No, inside about a lot of hours.
Oh, we don't go in because inside have a lot of buyers. So we put his mask on and we wait our turn. There's 4 people in front of us. So these guys are open almost every day of the week. They have an hour for lunch. Maya.
阿妹係啊，阿妹咁靚女嘅，唔係話你唔靚，咁阿妹靚過你啊！講笑嘅，阿妹後生啲啊嘛。我哋係咁老實嘅講嘢。又抽水，食咗嘢未啊？
食咗啦，食咗跟住
食咗
喺邊度食啊？
雜醬咯。
夾雜米啊？
哦，我隔離啊，我喺隔離啊，我頭先喺隔離。
咩軒啊？
係啊，貴軒隔離啊，係啊。好啦，
拜拜啦。
仲有兩個啦。
買餸㗎嘛我。
Anyway, so there's that thing. So he's getting ready to go into the doctor.
So if 600, that means about
60 or 70 US.
yeah, no, it's more. You times by 8. So it's about 70. I think 70.
$70. Yeah, $70 for office just to go to the doctor. But they also give you the medicine.
Yeah.
So basically, it works. It's a lot more easier, cheaper, and whatnot. And you don't have to wait around for weeks for an appointment. So their healthcare delivery at least the what you call the basic level is pretty damn affordable and pretty darn accessible quickly. So that's one thing I can say for them as opposed to us. Now, if you want to go, if you have to have something done at the hospital, like,
搞錯。
anyway, that's my sister-in-law again.
我都係琴晚打到12點幾先翻嚟啊！佢今朝9點幾抄我起身。
When Lily puts her glasses on, she looks just like her sister. So anyway, but the other problem is if you want to go to like the hospital to get something done, it's different. You got to wait a long time.
No.
If
you
it's
have
public.
Emergency
Yeah, if it's
room.
emergency, yeah, you can get. But if you just like need to get something scheduled to be done,
Now the emergency room is 400 Hong Kong. That means about $50 US. You know, to check all your body, no matter X-ray or blood test or do all the surgery. That's included.
well, how long do you have to wait to do that?
If emergency, very emergency, they do the surgery.
If it's not an emergency,
just maybe waiting about 4 or 5 hours.
okay. There you go. So if you have a broken or something like that, or a broken leg, broken arm, you can go to the emergency room, get that fixed. Cut, trauma, that kind of thing. Triage, so on and so forth. Now, the schedule of like a major surgery, like you know, that's a different story. You got two options here. You have a private angle, which is much more expensive, or you have a public angle, which you can get is much more affordable. However, you have to wait until they can schedule it for you. Most of the major towns around here have a hospital there that you can go to. Now, the other thing is, when you get into a hospital room here, it's not like in the U.S. where you got one room, maybe one patient, maybe one room, two patients. Here you got one room and like 16 patients. It's different, right? At the hospital. In a public hospital, you got one room, maybe 16 patients in there, all sitting next to each other. It's kind of like a college cold dorm or something. But anyway, that's that. So there you go. A little bit of story of the Hong Kong man. Oh, he's getting ready to go in.
I'm waiting for inside.
All right, momenti. So here you go. Just show you how big this area is. Look, hold on here. Oh, look at this. And then the doctor's back in there. And then that lady back there's got the medicines, and she also like is the gatekeeper. So totally different style. Anyway, take care. Bye.